Hi, ladies and gentlemen. It's Dr. Julio Novoa. Today is September the 25th. So I wanted to follow up on a comment that I posted this past week. There's a lot of patients that are following us from the Felshi clip group and the surgical, like for the gallbladder group, and surgical clips in general. So I had posted something called what I call a triple whammy related to exposure and potential side effects and issues with the use of surgical clips or any foreign body. And the triple whammy would be anything like the breast implants plus Essure plus surgical clips, or any combination, breast implants, vaginal meshes, hernia meshes, plus surgical clips, plus Essure, plus Felshi clips, plus anything. If you wanted to include it, just put it all in one basket. And unfortunately, for those that have all of these together, I feel for you as your potential issues and potential problems that you may have. So why are we talking about it like this? Well, each time you add a biological implant to one that you already have increases your risk of overall systemic problems, because your body notices that is a foreign body, starts to act against it, and it becomes a systemic problem. Many times mimicking autoimmune diseases such as lupus, fibromyalgia, but in worse, it actually intensifies the response to these autoimmune diseases or the reactions that are felt by these autoimmune diseases. So that's the key here. So to answer the question, which I keep getting the same question, is do I believe that surgical clips pose a potential problem for patients? Absolutely. There is no doubt about that. Now, does it happen to every single patient? No. Here's the key and why it's so hard. It's like under the radar is this point. Surgical clips do not affect every single patient that gets a surgical clip. Although surgical clips are a foreign body, not everybody reacts to the surgical clip. Now, what you have to remember is that maybe 5 to 10% of patients will have a severe or very serious reaction to a surgical clip. But because it's under the radar, doctors still use them without permission, mind you. Remember, they're not getting permission to put a foreign body in your body for the rest of your life. What we also have to remember is that these surgical clips, whether or not they're titanium or nickel, they do induce a foreign body reaction, localized. We have this in documented cases. Not only that, there's an extensive amount of documented research in the foreign body reaction, the formations of granulomas, the localized effect at these foreign bodies, but more importantly, the systemic effect, because these surgical clips degrade over time. They oxidize. Basically, they rust. Okay, so you have these devices that are in your body for the rest of your life that over time will oxidize, will release ions into your tissue, and can wreak havoc to your body. So under no circumstances should any surgeon, any doctor tell you that they're not without potential risk to leave a surgical clip in your body, whether or not it's gallbladder or any other type of clip. That is the naiveness of the doctor, not knowing, not researching what these surgical clips can do. And the fact that many surgeons push the use of surgical clips because, quite frankly, it's so much easier to use a surgical clip rather than tie a knot. But that should not be left to harming the patient as far as these issues are concerned. So that's the key related to surgical clips. Now, because it is a foreign body, if you already have a foreign body like breast implants, like Felshi clips, like the Essure permanent sterilization device, or if you have hernia meshes, your body can be exposed to multiple foreign bodies at the same time, and therefore the overall effect and overall symptoms may be very, very systemic in nature. And so you can have hair falling out, cognitive changes, significant weight gain, rashes, localized pain. Here's a key to what I've noticed at surgical clips. If you've had a gallbladder removed and you have a surgical clip in that area, you're going to have pain there. If you've had it in your throat, removing the thyroid, you're going to have pain there. If you have it in your back, you're going to have pain there. In the pelvic areas, you're going to have pain. Pain is one of the leading signs that you're having a reaction to a surgical clip. And keep in mind that despite the fact that people are doctors, these well-knowledge people are telling you the fact that there are no problems with surgical clips, they're absolutely wrong. There is potential issues with them, and I'm going to provide a link related to that on this part of a two-part discussion related to the use of surgical clips. Now, I'm just going to give you the heads up on it. The second part has to do with hysterectomies and the use of surgical clips, or hysterectomies and the potential risks of diabetes, and also the removal of the ovaries and the increased risk of diabetes. That's my second part. But the take-home message for this part of surgical clips has to do with, number one, surgical clips are not benign. Number two, they don't affect everyone, but affect enough people that it's become a serious issue. Number three, they're being placed without informed consent. Number four, they can very likely induce foreign body reactions that make things worse if you already have a foreign body, a biological implant such as breast implants or a Essure or hernia meshes already in your body. Keep that in mind. Please be your own patient advocate. Do not accept an answer from a doctor that tells you that a surgical clip is not without problems. And when you can, try to find a doctor that's willing to remove the surgical clips if that's at all possible. Thanks so much for watching. Please watch part 2, surgical clips and hysterectomy. I'll be presenting that in just a little while. Thanks so much. Take care.